So, hello, hi. So, today I'm going to teach you or to explain to you about chest physiotherapy. Chest physiotherapy is a group of physical techniques or therapies that improve your lung function and help you to breathe better. So it helped to expand the lungs, so it strengthened the breathing muscles and it improved the drainage of the thick lung secretions. Uses: it is used to assist in coughing, re-educate your breathing muscles, and improve the ventilation of your lungs, which help as it is as it helps in clearing the secretion from your lungs. Now, the therapies that include in chest physiotherapy are postural drainage, chest percussion, and vibration. So that I'm going to explain it in the next slide. So chest physiotherapy should be followed by productive coughing or by suctioning of the loose mucus secretion. And remember that chest physiotherapy, it should not be done after meal or drinks because that it might lead to vomiting. Indications: it is indicated for patients in whom the cough is insufficient to clear the mucus or to clear the secretion, or sometimes if there is any localized secretion that is present in the airway of the patients. Now, examples: other conditions might be in case that in case of cystic fibrosis or bronchiectasis, atelectasis, lung abscess, or pneumonia. So these conditions, these disorder conditions in your lungs, it leads to increased build-up of secretions in your lungs. Contraindications: it is contraindicated to perform chest physiotherapy in case if the patients have an increase in ICP or unstable head or neck injury, or if there is any active hemorrhage or hemoptysis, if there is any recent spinal injury, rib fractures, frail chest, uncontrolled hypertension, anticoagulation, and thoracic surgeries. So if a patient is present with these conditions, so that it is contraindicated for the patient, or it is contraindicated to perform the chest physiotherapy for the patient who is having this disease conditions. So that's why before performing the chest physiotherapy, we need to assess the patient thoroughly. Precautions: while doing the suctioning, we need to keep the suction apparatus or the emergency airway and oxygen therapy while providing chest physiotherapy. Now, the patient should be monitored throughout the therapy. Now, if required, adrenaline bronchodilators in solution should be available in case of bronchospasm during the therapies. Now, provide a coughing instructions prior to therapies. That means you need to teach the patient or explain to the patient after each and every steps of chest physiotherapy. The patient need to cough out to clear the secretions. Or in case if the patient is unconscious, then we need to suction the trach. We need to do the suction if it is essential. Now, complication may arise like hypoxia, increase in intracranial pressure, acute hypotension, pulmonary hemorrhage, pain, injury to the muscles, vomiting and aspiration, and bronchospasms. So we have to be very careful while performing these procedures because of these following complications. Now, equipments used in chest physiotherapy. The number one, that is the Trendelenburg bed, the pillow to support the patient gown untoweled, sterile clothes of the patient, basin, stethoscope to auscultate before and after the procedure to check for the breath sound of the patient, suction apparatus, mechanical precursor, cardiac monitoring, pulse oximeter, chest radiograph, emergency airway. So these equipment need to assemble near the bedside of the patient before performing the chest physiotherapy. Especially it depends, especially if the patient is unconscious. Now the procedures of chest physiotherapy. We need to assess the chest x-ray for any pulmonary findings, assess the respiratory rate of the patient, assess the breathing of the patient. Now the rhythm, the skin color, the blood pressure of the patient, the heart rate of the patient, assess whether the patient able to take breath or the patient is having difficulty to take breath, or if there any changes in the color of the skin color. Now we need to perform the chest physiotherapy. While performing the chest physiotherapy, we need to monitor throughout the therapy. Now we need to monitor throughout the therapy for these following. That is, if there is any reaction changes in the patient while we are performing this chest physiotherapy, especially if there is any complication arise. Now discomfort or dyspnea of the patient, or any heart rate and rhythm changes, or the sudden changes in the respiratory rate of the patient, or when you ask the patient to cough out, when you check the sputum, if there is any changes in the sputum production, changes in the colors, or the changes in the breath sound of the patient, skin color, or any the changes in the mental status of the patient, increase or decrease in the oxygen saturation of the patient, dropped out or increase in the blood pressure of the patient, modify the techniques of chest physiotherapy according to the patient's tolerance. So these are the conditions that you need to continuously assess the patient while performing chest physiotherapy to avoid any complications to arise. Percussion. When we talk about percussion, you need to position your hand, and you need to cup up your hand so that your fingers and thumb, it touches the chest of the patient or the area where you need to drain. And at the same time, that is with the help of chest percussion, that secretion which is present over the particular area is being drained into the large airway. Now next, this is the hand, that is the correct way that you need to cup your hand for chest percussion. Now perform the chest percussion by striking the chest of the patient with your cup hand. Now the procedure should produce there should be a hollow sound, and it should not be painful. So you need to perform the percussion. It should be over the single layer of the throat of the patient, not on the button or zipper, because that it creates as a friction direct to the skin of the patient. Now, while performing, when you perform the percussion, you need to remember the contraindication of the patient. If there is any contraindication, the patients, like for example, if with a bleeding disorders, osteoporosis, or the fractured ribs, or any open wound and surgery. So we need to be concerned on these on these particular contraindications for the patient while doing percussion. Now don't do percussion over the spine or sternum, stomach or lower back, as the trauma can occurs or it might cause any injury to your internal organs. So when you do percussion, at least it should be 30 to 60 seconds several times a day. But if the patient is having any thick secretion, so that area need to be percussed at least 3 to 5 minutes several times per day. So this is how the nurse performing percussion. Vibration. Vibration is a gentle shaking pressure that you apply to the chest wall of the patient, that is to move the secretion from a smaller airway into a larger airway. So the nurse used the rhythmed contractions and relaxation of our arms and shoulder muscles over the patient's chest. So when you do vibration in the patient's chest, you need to place your flat hand firmly against the chest wall on the appropriate lung segment to be drained. Now after each vibration, encourage the patient to cough and expectorate the secretion into the sputum container. But in case if the patient is unconscious, so in between we need to do suctioning to the patient to remove the secretion. Now this next slide I'm going to show you the steps by the nurse performing chest physiotherapy.
Chest Physiotherapy. Hi, Christine. The doctor has ordered chest physiotherapy on your right posterior segment, and it's just to help you pump out secretions that you're not able to on your own, okay? Okay, what I want you to do is go ahead and lay it on your stomach. Okay, and then we're going to have your upper part of your body at a quarter of a turn, and we'll have the close for some close. Go ahead and hug the close. And I'll give you these for you pump up. Okay, with both hands, I'm going to percuss over what's the scapula. And we're going to do this for about 15 minutes. And we'll take breaks in between. After we're done, I'm going to ask you to take a deep breath in. And as you exhale, do vibrations. Do this a couple of times. Another deep breath in. And exhale. Very good. Okay, we're all back. Let's go ahead and move you back into a low position. Do you have any questions at this time? Okay, thank you very much. And just let me know if you need anything.
Okay, so that is how where the nurse performing the chest physiotherapy, that is depending on the location of the secretion in the body of the patient. And so now the posture drainage is the technique when we that help is a technique to help to drain the lung secretions by using the force of gravity that drains the secretion from the smaller airway into the central airway, where they can either be cuffed up or doing the or suctioned out. Now, as I have mentioned, the gravity, it will help to move the secretion to the trachea, And the goal of postural drainage, it helps to drain the mucus from the affected lobes. So the video which I've shown you in the previous slide, that is how the nurse performing the chest physiotherapy depending on the affected lobes. Now, all the patients do not require postural drainage for all the lung segments, so the procedure must be based on the clinical findings. Now, if in postural drainage, the person is tilt or propped at the angle to help drain the secretion from the lungs. So, we need to keep the patient in a different position depending on the location of the secretion in the lobe, uh, in the lobes of the patient, or in the lobes of the lungs. Sorry. Now, what happened? Now, next, this lower lobes which required to be drained must be frequently, because the upper lobes be drained by gravity. So, in postural drainage, we need to keep the patient in different position depending on the location of the secretion, because it helps by the force of the gravity. So now, before postural drainage, the client may be given a bronchodilators or medication, or sometimes a nebulization therapy to loosen the secretions. So the postural drainage treatments are scheduled 2 to 3 times daily, but it depends on the lungs condition. The best time, that means before breakfast, before lunch, in the late afternoon, and before bedtime. But please avoid the hour shortly after meals. Now, help the client assume appropriate position based on the lung fields that requires to be trained. Now, if the secretion, it is retained in the apical area of the upper lobes, so we need to ask the patient to sit at the edge of the bed. If the patient is not be able to sit at the edge of the bed, we need to use a high forward position. So this is the picture that we need to keep the patient in this position. Sorry. Now, if the secretion, it is located in the posterior section of the lobes, upper lobes, we need to position the patient in a supine with a pillow under the hips and knees flat. In the middle or lower lobes, with the bed in the Drendelen's bird position, we need to position the patient in Sims position, that is to drain the lungs, the left secretion in the lungs, that is to drain the left lung. We need to position the patient on his right side. So if the secretion is present in the left side of the lung, that means we need to position the patient in his right side. But the same thing for if the secretion is present in the right side of the lungs, you need to position the patient on his left side, because with the help of the gravity, the secretion, it will be drained from a smaller airway to a larger, or to a central or larger airways. Postural drainage. Now this is the position of the middle lobes. Lower lobe, this is the position. You need to keep the patient. Now, after positioning the client, have the client remain at least in the same position for 10 to 15 minutes if tolerated. Now, after that, we need to perform the percussion and vibration by keeping the client in position. Then then it comes a sequence for chest physiotherapy as usual, right? Positioning, percussion, vibration, and removal of the secretion by cuffing or suctioning. Now, after chest physiotherapy, patients should be advised to practice oral hygiene if conscious, procedure to decrease the bad taste and odor, record the procedure, report all significant findings, and disinfect and all the non-disposable equipment, and use and store it appropriately. Thank you.